If you still haven't gotten the flu shot, our next guest is here to say that it isn't too late, and we'll also get some of the most common myths debunked.
Yeah, so welcome back to the show, Dr. Sean Murphy. Great to have you here again, Doctor.
Thanks for having me.
Coming off a long shift, again, like you did last time. Talking about the flu shot, I've been bad the last few years. I haven't gotten it. This year I did. You said, thank goodness you did, because it is so important. Why?
Well, particularly to help the most vulnerable in our community. Children and the elderly can be very sick from influenza. So it's important not only for you, but to protect others that you care about.
The more vulnerable members of the community, like you said. And people might have the question, why if I get it 1 year, do I have to continue every single year to sort of re-up the shot? What's the reasoning for that?
Well, the influenza virus is very crafty. It understands that your immune system forms memory, and it shifts every year, it changes its composition, so it's able to evade your immune system and every year try to gain a foothold in our populations.
And they're so small and they're so easy, right? I mean, what do people usually say when they don't get the flu shot? Do they say it hurts? Do they say I don't have time? Or if I do get a flu shot, I will get the flu? And that's one of the myths you say.
Yeah, I hear that all the time. Yeah, I got the flu shot and then I got the flu. Well, I mean, in truth, for instance, last year the CDC said the flu shot was about 29% effective. Now, that's still pretty good that we were able to prevent a third of the flu cases, but doesn't mean you're not going to get the flu. It doesn't mean you're not going to get sick. And at this time of year, people often do get sick. So there's a little bit of a miscorrelation there, I think.
It could be a coincidence, right? You may have already been starting to get sick from something else, and you just so happen to get the shot, and then you think, like you say, you correlate the two, when it really wasn't the shot, because what you're injecting is not a live virus, right? What is it?
No, it's a dead viral components, or basically the training components for your immune system to recognize that virus should it find it in the wild, the live virus.
And so if you put this off, you say it's not too late after Thanksgiving?
No, it's prime time right now. In fact, if you are still lacking your flu shot, you can come on down and we get it at the Tucson ER Hospital.
Right, and you don't want to procrastinate, but it's okay if you did. You can still get it.
It's prime time to get it right now. Yes, absolutely.
And so once someone does get the flu shot, how long does it take for it to actually start working or be effective against the virus?
It usually takes a few weeks for your immune system to form that memory, so the sooner the better.
And all ages can get this? Like, how young do you start, would you say? Because you said children are vulnerable at a young age.
Yes, generally it's recommended that after 6 months that children should get the flu shot, so 6 months are up.
Okay, and we're talking about toddlers and babies. If you're pregnant, can you get a flu shot? Should you get a flu shot?
Even more important for pregnant women to get a flu shot because of their vulnerability to having much more severe flu, which we've seen quite a lot of in town.
And what's great too is Tucson ER is going to offer for the first 100 healthy adults over the age of 18 that actually come in or call to get free flu shot. It's really wonderful. Tell us a little bit more about Tucson ER. We're watching video here, what you're all about and what you envision for the community.
Certainly. So Tucson ER Hospital, we're the only physician-owned hospital in Tucson, and we're attempting to be a great resource to provide personalized, compassionate care to the community, which up to you, but could be lacking.
Right.
So this year we're offering as a promotion to the community to offer 100 flu shots to adults over the age of 18 who come in, no questions asked other than a few screening questions. You can get a free flu shot.
And this is a relatively new concept of how you run this hospital. Why do you like this better from a typical hospital?
Well, for myself and for the other staff, which I can definitely speak for, they really like the opportunity to not be overburdened with a colossal number of patients and unsustainable nurse or physician to patient ratios. We have time to actually sit down and go through your symptoms in detail, order all the diagnostics that are needed, and actually explain them instead of hurting you out as quickly as possible and getting on to the next person.
And I think we can speak for the Tucson community that we like that as well.
We love it. It certainly is part of the future of medicine, that we have to change the way we think about it, that we do need explanations and we do need doctors to take the time and explain things to us, and especially when you're giving, for example, free flu shots. It really is helping the community in general be healthy, because if one person's healthy, we're all going to be healthy. So thank you, doctor, as always, for being here. Nice to see you.
My pleasure.
And the first 100 adults, as we were saying, healthy adults over the age of 18, to visit the Tucson ER and Hospital will get a free flu shot. And if you want more information, check out TucsonERHospital.com or call 520-375-9111.